What if the real reason your feet feel cold, your legs feel heavy, and your energy drops after 70 is not simply your age? What if one small movement, done correctly for just a few minutes a day, could help wake up the circulation in your lower body and make walking, standing, and even getting through the afternoon feel easier again? Most people over 70 are told to accept a slow decline in circulation as if it is just part of getting older. They hear things like, "That's normal at your age," or "Of course your legs get tired now." And after hearing that enough times, many people stop paying attention to what their body is trying to tell them. But here is what surprises many older adults when a surgeon explains it in simple language. Poor blood flow in the legs is not always just about the heart. It is not always about blocked arteries either. Very often, it is about movement. More specifically, it is about one key muscle system in the lower body that quietly helps push blood back upward every time you use it. And when that system becomes weak, inactive, or sluggish, blood tends to linger in the lower legs longer than it should. That is when you start to notice the signs. Heavy legs by the afternoon, stiff ankles, swollen feet, tight calves, a sense that your lower body feels older than the rest of you. And here is the part many people miss. Walking alone does not always fix it. Walking is excellent. It supports the heart, the lungs, the brain, and overall mobility. But after 70, many people develop a walking pattern that is shorter, slower, and less forceful through the lower legs. In other words, they may still be moving, but they are no longer activating the exact muscles that help circulation the most. That is why many clinicians, physical therapists, and vascular specialists quietly recommend one extremely simple exercise that looks almost too easy to matter. But it does matter, because this one movement directly targets what some professionals call the body's second heart in the legs. That second heart is your calf muscle pump. Every time your calf muscles tighten and release, they help move blood upward against gravity. That matters even more after 70, when people tend to sit longer, stand less, and lose some of the natural spring and strength in the lower legs. When the calves stop doing their job well, the blood flow can become less efficient, and when blood flow becomes less efficient, the whole lower body starts to feel it. That is why the number one exercise many experts recommend is not intense, not complicated, and not risky. It is the simple heel raise. Not a fast one, not an athletic one, not something done for performance. A slow, controlled heel raise. Done with support, done with intention, done in a way that helps your body remember how to push blood upward again. And if you stay with me, I will walk you through exactly why this movement works, how to do it safely after 70, what mistakes to avoid, and why many older adults say their legs feel lighter and more awake within a few weeks of practicing it consistently. Before we get into it, if you enjoy simple health guidance made for older adults in plain English, subscribe and stay connected. And if this message speaks to you, leave a comment with your age and where you are watching from. I always love seeing who is here with us today. Now let's talk about why this one movement matters so much. After 70, circulation changes for many reasons. People sit longer. They may feel less steady on their feet. Their stride becomes shorter. The ankle joint often gets stiffer. The calf muscles may become weaker. And some people begin avoiding movement without even realizing it, especially if their legs feel tired, swollen, or uncomfortable. The result is a quiet cycle. The less the calf muscles work, the less help blood gets moving upward. The less efficiently blood moves upward, the heavier and more sluggish the legs can feel. And the heavier the legs feel, the less people want to move. This is one reason a simple heel raise can be so helpful. It interrupts that cycle at its source. When you lift your heels and rise onto the balls of your feet, even just a little, your calf muscles contract. That contraction gently squeezes the veins in the lower legs and helps move blood back toward the heart. When you lower the heels again, the muscles relax. Repeating that pattern creates a pumping effect. That pumping effect is simple, but it is powerful. and it is often overlooked because it does not look dramatic. A study in older adults with reduced lower limb circulation has shown that repeated calf muscle activation can improve venous return and support better lower leg comfort over time. What matters is not intensity. What matters is consistency and control. That is important because many older adults do not need another hard routine. They need something they can actually do every day. Something safe. Something repeatable. Something that respects the body they have today while still helping it function better tomorrow. That is exactly why the supported heel raise is such a smart exercise after 70. Here is how to do it safely. Stand behind a sturdy chair, a kitchen counter, or any stable surface you trust. Place your feet about hip-width apart. Rest your fingertips or hands lightly on the support, just enough to help you feel secure. Stand tall, but stay relaxed through the shoulders. Now slowly lift your heels off the ground. Not as high as possible, just as high as feels comfortable and steady. Pause for a brief moment at the top. Then slowly lower your heels back down with control. That is one repetition. What makes this effective is not how high you go, it is how calmly and deliberately you move. Think of it less like exercise and more like a signal. You are sending a signal to the calves. Wake up, do your job, help the blood move. Start with 8 repetitions, then rest. If that feels comfortable, work your way up to 10 or 12 repetitions. Over time, many people can do 2 sets once or twice a day. But there is no prize for rushing. Slow and steady is where the benefit lives. Now let's talk about what you should feel. You may notice the calves gently tightening. You may feel mild warmth in the lower legs. You may become more aware of your feet and ankles. That is normal. What you should not feel is sharp pain, severe cramping, dizziness, or strain that makes you hold your breath. If that happens, stop and reduce the range of motion, or speak with your healthcare professional before continuing. And that brings us to one of the biggest mistakes people make. They turn a healing movement into a performance. They bounce up and down too fast. They grip their toes. They tense their shoulders. They hold their breath. Or they try to go too high, too soon. That is not necessary. In fact, it often reduces the benefit. Remember, the goal is not to impress anyone. The goal is to improve blood flow, muscle activation, and confidence. A slow heel raise gives the calf muscles time to fully contract and release. A rushed heel raise often becomes just a bouncing motion with much less control. Another mistake is doing the movement with the body leaning too far forward. Try to stay tall through the torso. Let the movement come mainly from the ankles and calves. If your balance is not what it used to be, that is completely fine. Keep more weight through your hands. You are not cheating. You are creating safety, and safety is what allows consistency. Now here is something important many people over 70 need to hear. This exercise is not only about blood flow. It is also about preserving independence. Because the same calf muscles that help move blood also help you walk, steady yourself, rise onto your toes, adjust your balance, and move with more confidence. When these muscles become inactive, the body does not just feel more swollen, it often feels less reliable. That is why such a small movement can have such a large effect on daily life. Better circulation can make the legs feel lighter. Better calf activation can make standing feel steadier. Better ankle movement can improve walking mechanics. And all of that adds up to something much bigger than exercise. It adds up to freedom. The freedom to move through your house without feeling like your legs are dragging. The freedom to stand in the kitchen a little longer. The freedom to go for a walk without feeling heavy halfway through. The freedom to feel more like yourself again. Now, if you want to get even more benefit from this exercise, there is one simple upgrade. Do not just go up and down. Add a pause. Lift the heels slowly. Pause for 1 second at the top, then lower slowly. That tiny pause increases the quality of the muscle contraction and helps the body engage more intentionally. For many people, pause is the difference between mindless movement and truly therapeutic movement. You can also do a seated version if standing feels too difficult at first. Sit in a sturdy chair with your feet flat on the floor. Keep the balls of your feet down and slowly lift your heels. Pause, then lower. This seated version is gentler, but it still activates the calf pump and can be especially helpful first thing in the morning, after long periods of sitting, or on days when energy is low. Some people even use it during television commercials, while waiting for the kettle to boil, or before getting up from a chair. That is a smart strategy, because the best exercise for circulation is often the one you actually remember to do. Now let me tell you what usually happens when older adults begin doing this consistently. The first change is not always dramatic. Sometimes it is subtle. Their legs feel less tight by the evening. Their feet do not feel quite as cold. Their ankles feel a little less stiff when they first stand up. Then, after a few weeks, many notice something deeper. Walking feels smoother. Standing feels more natural. The lower legs feel more awake. And perhaps most importantly, they begin to feel less afraid of movement. That matters more than people realize. Fear slows the body down. Confidence wakes it back up. And confidence often begins with one simple movement that feels safe enough to repeat. Now, a quick word of caution. If you have severe leg pain, sudden swelling in one leg, chest pain, shortness of breath, skin discoloration, or a known vascular condition that has not been medically evaluated, this is not something to ignore. In those cases, it is important to get proper medical guidance. Simple exercises can help many people, but they are not a substitute for care when the body is showing warning signs. For everyone else, this movement can be a beautiful daily habit. Simple, quiet, low strain, high value. And if you are someone who keeps thinking, can something this easy really help me? That is exactly why it works so well for so many people. Because easy means doable. Doable means repeatable. Repeatable is what creates change. Not once, not for 2 days, but over time. That is how the body responds best, especially after 70. Not through punishment, through partnership. So if you have been waiting for the perfect routine, do not overlook the humble heel raise just because it looks small. Some of the most powerful changes in the body begin with movements that seem almost too simple to count. This one counts. It supports circulation. It activates the lower legs. It helps the body fight gravity. It can be done safely with support. And it fits into real life, which is exactly why it has a better chance of helping you than complicated advice you never use. As we close, I want you to remember this. Aging does not always ask for bigger effort. Often, it asks for better signals. The body still listens. The muscles still respond. The circulation system still benefits from thoughtful movement. And even after 70, the right exercise can help your legs feel more alive than they have in a long time. So if you try this, start gently. Use support. Move slowly. Breathe normally. And give your body the chance to respond. Because sometimes, the number one exercise is not the hardest one. It is the one your body has been quietly needing all along. If this was helpful, leave a comment with the word flow, so I know you stayed with me until the end. And tell me, do your legs feel more heavy, more cold, or more tired during the day? I would really love to hear your experience. Thank you for spending this time with me.